Hey, welcome to the
Doceree Dialogues.
a platform that unites industry leaders come together and exchange ideas, innovation, and insights.
Shaping the future of healthcare marketing.
For joining us for Doceree Dialogues. Why don't we start off with this? Let's start off with some introductions, and then you can go forward and talk about your name, the company, and so on.
Sure. I'm Olivier Chateau. I'm the founder and CEO of Health Union. We primarily build patient communities, but more recently have expanded into the HCP space. Prior to founding Health Union, I worked for a decade at GSK in various marketing roles. I'm happy to be here, so thank you very much.
Perfect. Well, happy to have you. First off, what drew you here to the conference this year?
You know, it's interesting. I think post-COVID, people want to get together more than ever.
Yeah.
I think they're excited to see each other. I will tell you that I think we see more innovation and more disruption in the last 2 years than we have seen in a long time. And I think also partners be amongst each other, like Doceree and us, as well as, our customers, pharma and biotech companies, are more interested in having dialogues today than ever before. So it's a good time to be here.
Perfect. I'm interested to hear why do you think just over the past 2 years that you're seeing a lot more of that innovation and maybe even disruption in the market? Is there something that maybe triggered that, or?
I think technology is part of it. I think, post-COVID, you had like so much change has happened and then it
Right.
resettled.
Right.
And then you had this technology influx. I think there's a lot of progress made in data connectivity, being able to actually connect the dots to actually measure value. So be on the HCP side, on the consumer side as well. Still a lot of work to be made, but I think the level of awareness and in general belief that you're going to be able to get better over time and that's going to accelerate. And if you can find the right partner to deliver value, it's becoming bigger, larger, faster than before.
Right.
Yeah.
And I think there's an overall interest, right, to just kind of advance
Mhm.
in this, especially as we think about data.
Yeah.
And, coming into this ecosystem, I was frankly shocked of how fragmented data is within just kind of life sciences and healthcare. Just all of the advancements that you see from the outside, from the medical side and clinical side. But when you think about digital marketing, it's still kind of in its infancy, right? It's still kind of creeping up to other kind of industries out there. What do you think is probably going to be the big thing of how we can, or maybe even the big change that we're going to see in market that would help folks to start embracing kind of data more, to be more data driven?
So I'll tell you, like, the traditional pharma model of having a lot of reps has not disappeared. There's still a lot of them. I think for many years, you had different paths. I like to call them highways.
Yeah.
And you had different lane. One lane was your reps, one lane was digital, one lane was, amplification and so forth. I think all of those are merging.
Yep.
And they are starting to be seen more as, how can I don't like really the term integrated, but more how do they work together to actually deliver the highest amount of value?
Right.
You see it both from a CRM technology standpoint. You're going to start to see more on an activation standpoint, and then really on the full loop, especially when it comes to HCPs. I also think on the patient side, we are on the verge, like early days of personalization.
Okay.
To make people experiences as they're going through their ups and downs in their disease, like they have never seen before. Being able to relate to people that are just like them, that went through similar experiences, by respecting people's privacy, but yet providing like very intense moments of validation and support. And I think all of those things, like rather than being seen like different part of your, tactical plan, if you will, they're going to start to become a lot more orchestrated, integrated, working together.
Got it. So, pulling on that thread about working together, we are obviously a partner of ours within our marketplace, which is a collection of not only first but also third party data, right? We believe in an open and agnostic ecosystem, allowing our customers to be educated on the different types of data sets that are available. What really kind of differentiates Health Union amongst others who are probably in there as well?
Thank you for asking the question, because I think it's very important. We sit both on the patient and on the doctor side.
Okay.
On a very different data set. And I say it carefully because it's not the best. It's not the only one. It's a different data set that is the most important. The first part of it is that it's a fully consented data set with a contributor. So we actually can show you, we have asked people for the right to collect their information and then basically build some products. We can tell you when we acquire the consent. If people change their mind, we remove them from our data set.
Right.
We believe in a future where people have the right to choose. And if they say no, it's okay.
Of course.
I think on the HCP side, equally consented, but more interestingly, it's more like how can it be integrated with the data set of the consumer, with the data set of the doctors to generate value in the future.
Right.
On a first party
right.
standpoint, and not on the first and third, on the third and first. And for us, we believe that we can drive innovation and differentiation by having two first party data sets of consented people.
Okay.
That ultimately, when we work together and collaborate with you guys, will provide some incrementality, some innovation, and some ability to drive some pretty significant increased value in the marketplace.
Got it. As you know, within Docere, we're focused 100% on the HCP.
Yep.
So everything that we do primarily is making sure that we deliver the right message at the right time to that particular HCP, either during workflow, pre and post, or maybe even during kind of a patient experience. How do you think about identifying the right HCP utilizing your data?
Yeah. So it's actually interesting because our data set is primarily driven by personal emails because it was built on the foundation of being a physician recruitment business.
Right.
And when a doctor potentially looked to change hospital affiliation from Philadelphia to San Francisco,
right,
they don't use usually their Penn Health email, but their personal email.
Right.
So we kind of look at it as complementary to the identity and solution that you may have at Docere within your own graph or within the partnership that you have with others.
Got it.
And so I like to say we're here to come and complement access to that HCP at those right moments, depending on where they are in that workflow.
Got it.
So probably not within the EHR, but outside of the EHR, we'll probably have an ability to actually connect with that HCP in a pretty interesting ways that could be augmenting what you currently have so that you can have it, at a different time in the moment. It's actually, the reason I say that to you is everything we do at HealthInion, we think of it as how the other constituent would see that solution.
Okay.
So on the HCP front, how would a physician see that solution and how a pharma HCP marketer would see that solution?
Got it.
Same on the consumer side. And I think it's very important is that, our solution are complementary in the sense that you're going to have very strong foundation on the EHR front because you're going to have them in their workflows that they use their Penn Health email. But then as soon as they get out of that, maybe I'm able to actually help you enrich it once that EHR session is over.
Got it.
So
got it.
That's it.
Perfect. How do you think about like from a marketer perspective, because a lot of marketers are going to be listening to this and hearing this, is what objectives do you believe that they should have in mind? They're going to have in mind when they start to think about, HealthInion is actually the right partner that I should work with.
So I like to say we're only trying to identify cohorts of behaviors that's going to drive value for the brand.
Got it.
So the question is, what is the cohort within your target list or enhanced target list that my identity and my solution for HCPs is going to come and augment your total activities or promotional work that you may be doing? It might be 10%, maybe 20%, maybe 30%, maybe 40%. It's not going to be all of it, but which part is going to enable that brand team to drive incremental value in that marketplace, in that situation, like incredible background in oncology, in ophthalmology, in neurology, in dermatology. Like there's 5 areas where the impact we can have is probably greater than the other ones.
Got it.
And depending on the brands, depending on where this sits, this impact could be, 10-15% incrementality. Sometimes it could be 30 or 40%.
Got it. I have 2 more questions for you. How does our partnership create new value for mutual customers who want to activate data on their campaigns?
So I think that's where it gets interesting, is that you have the choice of living in a silo and to say, look, I can partner with you guys to make it available. And this is where if you have a partner that are already leveraging your technology and other partner on your platform and they have an interest in leveraging ours, then it's a normal continuation. We should not make this a roadblock, but rather an opportunity. And I think it's the right thing to do. And that's why we're happy to collaborate with you guys. And then I'll say that because they live within your ecosystem, they have the ability to evaluate pretty quickly what is that incrementality, what is that value creation, and so forth. And that's also where it's important. I think we live in a market that is driven by results.
Yes.
And ultimately, the results dictate the values.
Absolutely. If you have any tips or advice for marketers that's thinking about how to utilize data, or maybe even different data sets that they could take advantage of in the market, because obviously they're inundated with so many options, and sifting through that is a task in itself. What kind of advice would you give them in terms of making sure they're utilizing the right data?
I would validate 3 things. The first is the source of that data.
Okay.
The second thing is that the work that you do is deterministic, that there's no room for probabilistic, especially in HCPs.
Got it. Yeah.
I'll give you an example. When I'm at home, my wife's in ophthalmology, I get served on LinkedIn ophthalmology ads.
Right. Okay.
Because we're on the same household.
Right.
Second I leave, I don't get them.
Yeah.
Is it probabilistic? Is it deterministic? Very, very important. And then the last is, I think AI is going to have a huge impact on this, is that the validation of that value when it's created, if you have a physician that is based in Philadelphia, are the activities or ad impression happening within 100 miles of Philadelphia? Like if the ad is delivered in Seattle, Washington, or Las Vegas, Nevada, there was no true conference in those 2 cities in that month. So your media needs to work smarter. Your activity needs to work smarter. It starts with a source.
Right.
You need to really understand how it actually is deterministic. It's really the right person. And then the reason why some of the platforms today do so well is because there is no gray areas. They are interacting with the right people at the right moment.
Right. Right.
And then the last one is kind of provide some guardrails so that you can validate that value and that continues.
Got it. So it sounds like it's the source of your data, making sure that it's deterministic, right? Because there's no room for probabilistic. No, that makes a ton of sense. I have my last question for you is, if you could have one superpower that makes HCP engagement more impactful tomorrow, what would that be and why?
So I wished that in a true 360 mechanism, the digital world and the rep world was so integrated that I give you an example. If a rep was supposed to see this doctor once a week, and this week they missed this appointment, a signal was sent to a platform on Friday. The digital ecosystem was willing or able to reach that person and have some activities. That activity would then be passed back to that rep.
Right.
Understand, was the message they interacted with, was it efficacy, was it reimbursement, was it competitive, and that the integration was a lot more seamless. Yep. So that those worlds are not separate. They are totally integrated.
Yes.
In a way that the rep sees that digital companion as a true partner.
Right.
More than this obsolete, I know that there is campaign happening around me.
Yep.
I'm pretty convinced it's going to happen.
Yep. Questions when?
It's going to take a little bit more time.
Right.
My superpower would be like, how can we speed that process so that we can arrive in better, smarter, integrated world where the reps and the digital tools work so much better so that it's more efficient for doctors, more efficient for the pharma companies, and quite frankly, more efficient for the patient that needs sometimes some of these therapies.
Right.
So.
No, I mean, you're speaking my love language, because when we start to think about this ecosystem, it is, again, like to my earlier point, it is fragmented today. People are working in different systems. It's not connected. Creating this connected environment is really where the key is, to kind of thread the entire process together, right? So that we can all be informed, right? And there's pieces of it happening and there's glimmers everywhere. It's just not quite there. So
I said the trigger happens. It's not fully full circle.
Yeah.
But it's, if it could happen, I think, and that's why I think you see a lot of innovation and desire for people, because today you can have better understanding of these doctors, their potential receptivity to all these different activities, be digital or not. the reality is the next frontier is how those two worlds actually are completely merged together.
Right, got it. Well, before we wrap up, do you have any closing thoughts or anything that you want to just kind of leave the listeners with?
I think do your diligence, test, try new things. It's okay to try something different. If it works, that's amazing. Then accelerate. If it doesn't, go to the next one. Ask the right question. Usually, if it makes sense and you can understand the process, the likelihood it's going to work.
Yep.
It's quite significant.
Got it. Well, I appreciate your time. Thank you again for being part of Doceree Dialogues. I hope you enjoy the show.
So,
We're absolutely looking forward to growing our partnership together. And yeah, we're excited for the future.
awesome. Thank you so much.
Great.
Appreciate
Thank you so much.
it.
All right. Take care.
Bye.